One of the problems with hepatitis B and C is that when they cause cirrhosis, in the long term, they can actually cause liver cancer as well. In fact, 70 to 80% of liver cancers occurs in patients who already have cirrhosis. Therefore, if you treat hepatitis B and C early, you actually are preventing occurrence of liver cancer. One problem with hepatitis B is that it not only infects your cells, but it gets incorporated into your DNA. Therefore, even if you don't get cirrhosis, in the long term, you can actually have cancer. Therefore, people with hepatitis B, it is important that they do regular checkup, usually by ultrasound test or some blood tests are there to make sure that you don't get cirrhosis or you don't get liver cancer. Now, hepatitis A and E, as I said, was predominantly being transmitted through unhealthy water or food. So what is crucial is that you maintain a clean, healthy lifestyle. Most importantly, in washing your hands, doing any unhealthy, whatever is not healthy, like touching in a dirty place or doing after your routine, urination, defecation, etc. Clean your hands very, very well with soap and water, as you was advised for COVID protection. Likewise, water should always be boiled before you actually drink it. You can cool it later, but you must boil it first. Likewise, food as well. Make sure that the food that you take from the fridge, it has to be boiled and then eaten. And also, it is important that you don't keep in the fridge again and again and again, because that can actually be a problem. Alcohol can also cause hepatitis, called alcoholic hepatitis. It usually occurs when you have a binge drinking. So people have the mistaken belief that, okay, I don't drink for 5 days a week and Saturday and Sunday I drink, that is okay. No, it is not. It is equally bad, sometimes even worse, because when you take 3-4 pegs of alcohol at a stretch, that can actually cause more damage to the liver than taking small quantities. Both are bad, of course. So what are the symptoms of hepatitis? Most people will know that they have a hepatitis only if you notice a jaundice in your eyes or if you do a blood test. So the blood test, what happens is your bilirubin may be high and your SGOT or SGPT, now it's termed as AST or ALT, when those values are high. Those are values, these are actually our enzymes that are normally produced by the liver, and they should stay only in the liver cells. They should not come out in your blood. Only very small amount comes out. So when there is an inflammation of the liver cells, these enzymes will come out through this leaky cell wall and manifest in your blood. That is why your SGOT, SGPT or AST and ALT goes up. And that is your actual diagnostic criteria. Your symptoms will be very subtle. You may have fever, you may have body ache, you may have feeling of weakness and tiredness and fatigue. And then when you notice discoloration of your urine or your eyes, that is the time when you actually diagnose that you may have hepatitis.